The Asperger's disorder patient is self-centered, exactly like the narcissist. He is engrossed in a narrow range of interests and activities. Social and occupational interactions with the autistic patient are severely hampered. Conversational skills, the give and take of verbal intercourse, these are primitive, rudimentary, very basic. The Asperger's patient's body language, eye-to-eye gaze, body posture, facial expressions and micro-expressions, this is all constricted and artificial. It's a little like the patient is imitating, not really acting or behaving. And this is very typical in other personality disorders, in personality disorders such as schizoid personality disorder, schizotypal personality disorder, and yes, narcissistic personality disorder. Non-verbal cues are virtually absent. Their interpretation in others is lacking. The autistic patient cannot properly identify, spot, detect social cues, sexual cues, behavioral cues, and grossly misinterprets other people's body language and even other people's verbiage, things they say. Now, all this is common to the narcissist and to the autistic patient. And it raises the issue of a chicken and egg. From a very early age, from the age of 3 or 4, the autistic patient is rejected sometimes by his or her own parents, by family, by peers, by teachers, by role models. This rejection is perceived as abandonment. It challenges the formation of object constancy. It elevates the level of anxiety in the patient. So many patients with autistic spectrum disorders develop narcissistic defenses. They defend against an environment which they perceive to be frustrating and hostile by essentially becoming narcissists. It's an open question whether in autistic patients, narcissism, pathological narcissism, is not actually a defense aimed as a positive adaptation to survive in an environment which is largely rejecting and hostile. The autistic patient is manifestly not, determinedly not functional. He is not antisocial. The autistic patient is not antisocial. He is simply asocial. The narcissist switches, fluctuates, pendulates between being over-social and being antisocial. The autistic patient often wants to be accepted socially. He wants to have friends. He wants to get married. He wants to be sexually active. He wants to sire offspring. The autistic patient just doesn't have a clue how to go about it. The effect of the autistic patient is limited. His initiative, for instance, to share his experiences with his nearest and dearest, or in a different setting, to engage in flirting and seduction and foreplay, he doesn't know. He is clueless. He is thwarted by his own deficiencies and inadequacies. The ability of the autistic patient to divulge his emotions, this ability is tilted. He is incapable of reciprocating. He is largely unaware of the wishes, needs, feelings, signaling of his interlocutors or counterparties. He's like a blind person in a colorful environment. So inevitably, autistic patients are perceived by others as cold, eccentric, insensitive, indifferent, repulsive, exploitative, haughty, arrogant, or emotionally absent. That's how people describe autistic patients. And this description is identical to the description of the narcissist. But phenomenologically, they are the same. Etiologically, they are not. The reasons, the etiology of narcissism has nothing to do with the etiology of autism spectrum disorders. That the autistic person and the narcissist behave the same means nothing. because their inner landscape couldn't be more different. To avoid the pain of rejection, autistic patients confine themselves to solitary activities. But unlike the schizoid patient, this is not by choice. They hate it. They don't want it. They feel inadequate. They feel humiliated by their own repeated, recurrent failure to engage, to integrate, to interact. And so they constrict their world. The autistic patient limit their world to a single topic, a single hobby, a single person, and they dive into this with the greatest all-consuming intensity, almost compulsively, almost obsessively, excluding all other matters and everyone else. Avoiding the world, constricting life, becoming a laser beam focused on a single topic, mathematics, physics, whatever it is, that's a form of pain aversion. It's a form of hurt control, regulation of emotions, which would otherwise overwhelm the autistic patient. He would experience emotional dysregulation, akin, for example, to the borderline patient. And so while the narcissist avoids pain, also avoids pain, by excluding, devaluing, and discarding other people, the autistic patient achieves the same result, avoiding pain, by withdrawing and by passionately incorporating himself in his universe and introducing into this universe only one or two people, one or two subjects of interest. The narcissist goes out into the world in order to somehow establish his superiority, somehow integrate in a hierarchy of dominance and relative positioning, being at the top. He regards everyone with contempt and disdain as inferior, not worthy of him. The autistic patient also withdraws from the world, but not because he regards other people as inferior and contemptible. He withdraws from the world because it's very painful for him to be in the world. So he minimizes his world. He has a tiny universe with one or two people he trusts, usually family members, and one or two topics he is engaged in. And in this sense, he again looks exactly like the schizoid patient, but the etiology is very different. The schizoid loves his existence. He is emotionally invested, he's affected in his existence. He likes to be alone. He likes solitary activities. He hates people. He hates the presence of people in his life, the schizoid. With the schizoid, it's a choice, almost one could say an alternative lifestyle. Not so with the autistic patient. The autistic patient does this because he has no choice.